Hi, I'm Sean, one of the news editors at Manx Radio, and we've been hearing from the British Medical Association as its members have voted in favour of industrial action as part of an ongoing pay dispute with Manx Care. 121 of the 127 doctors responding to the ballot have voted in favour of industrial action. So just what happens next, and when could we see doctors on strike? I've been speaking to Sean Crerand, a consultant orthopaedic surgeon, and Dr Prakash Thiagarajan, the chair of the Isle of Man Medical Society, who are both representatives of the BMA.
We can sense the level of frustration and anger amongst medical staff whose pay has been eroded over the past 15 years. And at least in the UK, the doctors there have received a partial restoration of pay. That hasn't happened here. And I think it's a reflection of that. And looking at it slightly differently, we also believe that it is a vote of confidence in the local negotiating committee, because at some times there were some suggestions that the local negotiating committee wasn't appropriately or accurately reflecting the views of the wider medical staff. But they've proven those rumours wrong.
And in terms of those 127 who took part in this ballot, what percentage is that of your members on the island? What was the turnout?
75.14% was the turnout.
You say you have had a series of meetings with Manx Care while this dispute has been going on. Have talks been ongoing during the ballot? Where are you up to with that?
Yes, talks have restarted, but we are yet to see a credible pay offer that will be acceptable to all our members.
Now, you say in the press release from the BMA, doctors want to give patients the best possible care. Are you concerned in terms of the way the pay erosion has gone, that doctors are in a position where they can't do that at the moment?
I would say yes, because of the number of gaps that we have. And the last time I checked, this is just overall, we had a 21% vacancy factor, which is not healthy for any health and care organization. And within doctors, it may actually be higher, because we see the number of gaps that then ends up getting filled by either very expensive agency locums or somewhat expensive bank locums. And then the ironic situation is, if the basic pay is fixed at a very competitive level, we will not have those gaps.
Now, you've talked throughout this dispute, this ballot, about wanting to avoid strike action. Having this support for industrial action, we know that industrial action can take quite a broad range. It can be quite a range of things. What would you be looking at from here? Would it be immediately looking at strike, or could there be something in between?
By law, I understand within 5 weeks of the ballot results being announced, we have to strike. As to what form it will take, we are actually meeting with the wider membership in the first week of the new year to decide that.
What's it been like for doctors during this ballot? What's the morale been like? What's the general feeling been?
I think that you can see from the results of the ballot that the general feeling is one of frustration, really, because we were really forced into taking this ballot, into taking the threat of industrial action. And it was only after that we were approached by Manx Care to negotiate. So I think that generally speaking, the general body of doctors, we don't want to take industrial action yet. We feel that our hand has been almost twisted into this sense of frustration, and that's reflected in the results of the ballot. Yeah.
Now, Manx Care and the Department of Health and Social Care, they've told us that they think doctors do deserve a fair pay rise. However, they say we must manage our finances and stay within our budget. Given the way the budget process works, can you understand where Manx Care are coming from with that statement?
We understand what they're saying, all right, and I think Manx Care have to look critically at their own financial management. We think that savings can be made. We think that they can be made without any detrimental effect on the delivery of patient care, as has happened recently with the cancellation of elective surgery. So we think that, yes, they are under financial stress, but we do think that a lot of that is of their own making, and we're certainly happy to help them to rearrange their finances in a way that will be useful for everybody, really.
And I would like to add that the year in dispute, 23, Manx Care's budget received 47 million more than the previous year. And the entire medical wage bill is 40 million. So potentially they have enough money to give us all 115% rise, and they've given us zero.
So when Manx Care then go on to say pay rises would mean reallocating funding from other services, potentially leading to cuts or service reductions, from your perspective, that's not the case.
We don't think so. We think that there are methods of reallocating funds that don't involve the delivery of services, and we pointed this out to them when the idea of cancellations of elective services were concerned. So we think, yes, they do need to be reallocated, but they need to be reallocated realistically. Manx Care and we want to provide the Manx public with a service which is useful, is economical, and we will be happily engaged if we are asked with Manx Care to help them to do that.
Now, as you mentioned, this pay awarded is for the 2023 to 24 pay year, financial year. It's almost 2 years since that pay year got underway. How frustrating is it not to have reached an agreement before now?
Very. In fact, the very first offer, which is still the only offer we've had for this year, was given to us 8 months after the pay award should have been implemented. And that is unusual and wasn't the case pre-Manx Care. Pre-Manx Care, we dealt directly with the DHSC, and the norm was the UK pay raise awards would be offered first. Occasionally we improved on that, but mostly we just agreed to the UK pay awards. And only since Manx Care came, they almost like they started with zero, no pay awards for about 8 months. I don't know whether the expectation was that we would be so frustrated by then we might just say yes. I don't know what the thinking was. But yes, it is extremely frustrating. And there really hasn't really been any negotiation, although we have been attending regularly the JCNC, which is the Joint Negotiating and Consultative Committee. We've only had just sort of offers and intransigence, to be honest. We really haven't had any give and take type of what people would understand by negotiations.
And it interferes with our ability to discuss wider issues as well, because pay basically for the last couple of years has taken over the business of, as Prakash was saying, the JCNC, the LNC and so on. But there are other things about the delivery of patient care that we would like to advance as part of that, and yet pay negotiations are always the bête noire in the background. So we would like to try and endeavour to solve this problem and also solve it for the future as well, so that this doesn't happen and this is not a yearly issue that is, as I say, frustrating our efforts to be proactive in providing a sensible and economical patient care.
Now, Manx Care say they're committed to talks in the new year. We know that the BMA have said they're open to that as well. What would you like to see from those talks?
A credible offer, by that I mean an offer at least as good as that in the other British Isles, that is acceptable to all our members.
I know previously you've said 12.6%. Is that still the uplift you'd be looking at?
That's what we're asking for, but we would expect something close to that. And if we want to look around the British Isles, their pay offers for 23-24 have been anything from 10.5% to 11.26%. I don't think any of us is going to say no to a comparable offer.
I know you said the strike action would need to get underway within around 5 weeks. In terms of what impact that would have on services on the island, 121 doctors voting in support, what would that look like for health services on the island?
We obviously would try and minimise any impact on patient safety. However, the patient experience is likely to be affected. Having said that, we really need to talk to the wider membership before deciding what exact action to take.
And we think the patient experience is at the moment detrimentally affected by, as Prakash said earlier on in the interview, by the fact that recruitment is a problem, retention is a problem, having a satisfied and motivated workforce is a problem. All of those reflect on our ability to provide a useful and safe patient care. So really, in the long term, this will, if the negotiations are successfully concluded, it will in fact help patient care, because we'll have a much more satisfied workforce, we'll have a much more motivated workforce, and all of that, as you well know, will help the delivery of care to our patients, which is, of course, our raison d'etre,
Yes, absolutely. Yeah. We're still hoping for a Christmas miracle, and that there will be a credible offer that appeals to all our members early in the new year. I hope that Christmas wish comes true.
And we don't want to go on strike. I mean, it's not in our nature to go on strike. But I think what the results of the ballot demonstrate is the depth of feeling about this issue, and the onus is on Manx Care now to come back with a credible offer so that we can continue to provide patient care without any disruption.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.